So I was asked to speak about making meaning after a breast cancer diagnosis. Making meaning after a breast cancer diagnosis. And I guess the first thing that I'd like to say is that, we had a discussion yesterday. We had a panel and we talked a lot about risk factors, those that are preventable and non-preventable. And no matter where you fall on the spectrum of understanding of those things, the first way that you can make meaning of this diagnosis is to understand and accept and really get it in the place where knowledge happens, that it's not your fault. There isn't a thing that you did to cause it. I don't care if you felt a lump. I don't care if you waited. I don't care if you knew you had a family history. You did not cause this. And no matter what your risk factors are, this happened to you. And I think that it's so important because, I see patients along every walk of life across the spectrum, whether they are super fit, whether they breastfed or didn't breastfeed, whatever their race, their socioeconomic status, their religion, their diet. This is something that happens to, 1 in 8. And more, unfortunately, across the world. And so getting that into your psyche, I think, frees you up to be able to now make a different meaning of this. The guilt that can be associated with breast cancer diagnoses in some cultures keeps them silent. It keeps them from sharing. It keeps them from exploring and making it transformative. So the first thing you need to know is that you didn't cause this, you didn't do it. You didn't bring it on yourself. It's not a curse. My favorite quote is by Wayne Dyer, philosopher. He's a writer. And he says, well, when you change the way you look at things, the things you look at change. When you change the way you look at things, the things you look at change. And our circumstances reveal who we are. And it's so important to recognize whether you have just been diagnosed or whether you are along your treatment journey or perhaps completed your treatment journey and into survivorship. The more you can change the way you look at the circumstances in your life, the more power you have over them to allow the more power you exert over those circumstances so that they cannot take over your life and you can make meaning of it. And so, when I think about my patient experiences and making meaning, I recall patients who have been in complete denial about their journey. They've been angry, scared, confused. And the work of removing cancer from their lives is much more than surgery. So I'm a surgeon, but the work of removing that type of cancer is more than just a lumpectomy. It's more than a mastectomy. It's taking a really good hard look at the toxic elements in our lives and one by one starting to eliminate them the best way that we can, the best of our abilities. I can think of 3 patients in particular who had some really interesting and transformative experiences. And the first patient was a social worker in a health system, local health system. And she had a lump and she felt a lot of guilt because she said, I knew and I waited. And I said, it's not your fault. And she said, yeah, but I knew and I waited and I'm not doing chemo. She says, you can take out the lump. I'm not doing a mastectomy. I'm not doing radiation. I'm not doing chemo. Okay, maybe the radiation, but I'm not doing chemo. And I'm not stopping smoking. It's my thing and I like it. And I said to her, okay. And so we began on our journey, and through the course of the journey and partnering with her and helping her to make the decisions for herself, and this is the thing that doctors need to know. And this is the thing that you as a patient, as an advocate, as a loved one, as a supporter can help us to know is that it's ultimately up to the patient. You have agency, you have autonomy, and our job is to help get you there in the way that is best for you, with you, from your mind and your personal beliefs. We cannot force on a patient what we should do. We should not paternalistically not offer patients certain things like reconstruction or clinical trials. And I think that, implicit bias is real in medicine. We had a wonderful Knowledge is Power conference, and we talked about some of the barriers to health equity, and implicit bias is certainly present. But getting back to the story, she went through her journey and we discovered through genomic testing that her tumor was likely to respond to chemotherapy. And I gave her the numbers and, she says, well, I have a granddaughter. I have a new granddaughter and I want to see that granddaughter. I want to see her live. And so I'm going to do this for my granddaughter. And I said, are you sure? And she said, yeah. She said, I'm going to do this for my granddaughter. And I saw her after her chemotherapy. It was adjuvant, so she didn't have the longest course. But afterwards, I saw her, I came into the room, and I had to walk back out, and I walked back in, and I said, "What happened to you?" She said, "I figured if I was going to have to do chemotherapy and it was going to upend my whole life and change everything, I might as well change the rest of the things I didn't like." So I dropped 20 pounds. I got rid of that son of mine who lived in the basement, who really needed to move out and go out on his own. I told my husband he needed to shape up. And she says, "And guess what? I quit smoking." All of those things happened as a result of this journey for her. And that moment was so pivotal for her. And I watched her evolve into a person who was much more open to whatever life had to bring her way and willing to share those things thereafter. The second patient I can think of is a patient who had her very first mammogram, and she watched her mother go through treatment, and she was diagnosed at stage 2. And she says, "I'm not doing this. I'm not going through this. I refuse." And she stayed in denial, and I watched her shrink. I watched her push everyone away. I watched her wither. I watched her not thrive, and I watched her advance. And every visit, I would say to her, "How are we doing? What are your thoughts? What can I answer for you?" And she just refused to move past the diagnosis and the fact that this had happened outside of her control, and there was absolutely nothing that she could do to change what was her inevitable fate. And that fatalism was really frustrating as a provider to watch, and it was very heartbreaking for her family as well. But my job as a physician is to educate and to support, and I did those things even in the midst of that. And it is okay to not be okay. And giving her permission to do that slowly but surely helped her to evolve into a place where she was able to consider some strategies. The last patient is one of my favorite stories to tell, and this is a woman who was diagnosed with breast cancer, triple negative breast cancer at 42, and she is now 80 years old. And she came to see me, and I gave her this diagnosis, and she said, in her own words, "I'm too old for this stuff." And she embraced her breast cancer journey. It too was triple negative. And I said to her, I said, "Well, my friend," I said, "this is your second breast cancer, and you were first diagnosed at 42. Have you ever thought about hereditary cancer testing, any genetic testing?" And she said, "No, but I heard about it. You think I should do it?" I said, "You should do it." And she had a BRCA1 mutation. And I watched her embrace the treatment journey. She went through chemotherapy at 80 years old. She took her grandkids to the zoo twice a week. She continued to volunteer at her church's soup kitchen and read to kindergartners. And this woman, I'm thinking, she's amazing. I can barely get myself home at the end of the day and feed my cat. And she ran circles around so many other individuals, even within our support group. And she said, she said, "I just knew that God had me." And she said, "If I had to go through it again, I was going to go through it differently. And this time I was going to go through it the way that I wanted to go through it." And she says, and that for me meant not giving up the things that felt good to me. I like reading to those kids. I like volunteering at the church. I like taking my grandkids to the zoo. And Nana might not be able to walk as far. And the kids know we've got to stop and take a breath, but that's okay. And it was beautiful because she got her family tested. And her daughter subsequently was diagnosed with a BRCA1 mutation, and we were able to do some really preventive things in her life and the life of the rest of their siblings. And it has changed everything in her entire family for generations to come, because she was brave and she was bold enough to do the testing and to go through the treatment. And she is still around, and she is still giving them hell. And it is just wonderful to watch. And so I say these things to say it truly is a journey inward before it is ever a journey onward. And making a cancer diagnosis meaningful, making it a meaningful, transformative life experience is so much more than pink. It's finding the humor in your daily experience. That patient who loved smoking, and guess what chemotherapy did? She couldn't stand the taste of it anymore. She's like, "I can't stand the taste of these things. It's useless." It's embracing being bald and being puffy from steroids, and being pale and being dry sometimes. And one of my favorite analogies about the cancer journey is by Living Beyond Breast Cancer and LBBC board member Jamil Rivers, a friend of mine who is the founder of the Chrysalis Initiative. And I asked her one day, I said, "Jamil, why the chrysalis?" And she said, "Because it's a dark and uncomfortable place to be, but that's where the growth and the transformation happens." And I've never forgotten that. I love that. So that's for yourself, for your family. It can look like conversations like never before. It looks like family meals. It looks like makeups and breakups and discussions that should have happened a long time ago about our really complicated health histories. It looks like teaching our children the importance of practicing wellness even in the midst of illness, and showing and teaching our family members how we need them to show up for us. I can recall a patient who was 41 years old and she didn't know she had a lump. She was diagnosed with stage 2 breast cancer and said, I feel so good. And, this is going to make me feel so lousy, this chemotherapy. And I said to her, I said, don't look to feel bad. If you feel good, keep feeling good. You feel well, keep feeling well. Don't look to feel ill. And I saw her at the end of her chemotherapy, and she said, I just kept hearing your words. If I felt good, to keep feeling good. She said, I only missed one day of work through chemotherapy, and it was the day after my second cycle. She said, but every other day I went to work. And there were some days when, I maybe took a half day and I wasn't feeling 100%. She said, but my family kept trying to bring me lasagna. They kept trying to bring me these comfort foods. And she said, and I didn't want that and I didn't need that. And so for her, teaching your family how to show up for you looked more like asking the family to take the kids so she and her husband could have a date night. It looks like for some people finally admitting that the sex really hasn't been that great. And no, it isn't all his or her fault because you haven't spoken up about any of it since the honeymoon. And now it is finally time to practice the true meaning of intimacy for yourself and for your spouse. And for others, not the least important, but until you reconcile all of the other things, it really is just performative. It's putting on the pink tutu and running down the street and, and that's great when it's for you and when it embodies what you feel best about yourself, but going inward and going through it and then coming out on the other side of the mental transformation. So I want to be clear that it is not just about where you are in your treatment journey, because some people will be in treatment for the duration of their lives. But it is the transformation in your mind that says, if I'm going to be in treatment for the duration of my life, I'm going to live my life to the fullest. And we live our lives to give them away in the service of others. Shirley Chisholm is responsible for one of my most favorite quotes, and she says, "The service is the rent we pay for the privilege of living on this earth." Service is the rent that we pay to live here. And so if knowledge is power, know that you educate every doctor, every office visit, just as much as they teach you, that you are becoming a subject matter expert in something that you never ever thought you'd have expertise in, and that you have the right to share what you've learned, even if you don't feel like the expert in the room, even if you don't know everything, because I'll tell you a big secret, none of us do. None of us do. And in the era of COVID, where women are afraid and foregoing screening, and they're not able to gather in the ways that make us feel like our best selves, and we don't have the tools, some of us don't have the tools to make us live our best lives. Women with a new diagnosis are looking to you to help them make sense of what's happening in their lives. And so making the most of the experience looks like partnering with health systems, being available for interviews and advertisements and reachbacks, and being available to mentor new cancer patients. It looks like partnership with advocacy groups like LBBC, faith groups, getting educated, getting creative. It looks like getting real, it looks like getting angry, but most of all, getting involved, so that no matter where you are in your cancer journey, you truly can embody what it means to live beyond breast cancer. I want to thank LBBC for inviting me to say a few words.